Right, well, after the age of 50, that's a good time to start thinking about getting tested for colon cancer. Well, Dr. Kohli is here to tell you how easy that can be.
Happy New Year, Dr. Kohli. How are you?
Hi, Danny. Happy New Year. I'm doing great. Thank you.
Good. All right. Well, today we want to talk about colon cancer, something that, of course, is really important that we discuss. What are the risk factors of colon cancer?
I'm so glad we're talking about this because we're now realizing that younger and younger people are getting colon cancer. So all of us need to have our radar up for it. So some of the risk factors, Danny, are non-modifiable, things we can't control, like how old we are. So being older is a risk factor, our genetics, if we have a family member who's had colon cancer, if we have other conditions like inflammatory bowel disease or other types of conditions that increase inflammation in the colon, those can also increase our risk. But the good news here is there's also some risk factors that are modifiable. They are within our control. So smoking and alcohol use, for example, can increase your risk of colon cancer. Certain types of diets, so eating diets that are high in red meat and preparing the meat in certain types of ways, eating a lot of processed food, all of those can increase your risk of colon cancer. It's something you really want to think about cutting down. And then also being overweight or obese can increase our risk. So beginning of the year, it's a great time to think about what we can modify to reduce our risk.
Yes, definitely. And of course, this is all preventative. So this is something that, we can look for when it comes to making sure that that doesn't happen. What are symptoms do people need to be on the lookout for if maybe this is something they should be worried about?
So the symptoms of colon cancer really depend on where in your colon the cancer is. So if it's in the proximal part of your colon, meaning it's high up in the colon, you may not have any symptoms at all. And that's why it's so important to do regular screenings. But if it's lower down, or if it's in a place where, the cancer might be bleeding or causing some problems, you can have symptoms like abdominal pain, early satiety, you can have bloating or discomfort, you can have blood in your stool, you can have a change in your bowel habits. So if any of those happen to occur, you really want to make sure you talk to your doctor.
Okay. Well, lucky for us, we have 9Health 365, and they of course have their colon cancer screening kits on sale, and that's through the end of January. So who might these kits be useful for, and who would these kits maybe not be so useful for too?
Yeah, so these colon cancer screening kits are really convenient. You could do them at home. They're easy to do. And essentially what you do is just take a small sample of your stool and rub it on this card. And what it looks for is blood in the stool. So if you have a small microscopic cancer that's oozing a little bit of blood into your stool, this will pick it up. Now, keep in mind that the kit doesn't know if the blood is coming from your colon cancer or it's coming from something else like hemorrhoids, for example, which a lot of Americans have. So if you are somebody who has hemorrhoids, this would not be a good test for you because you could get a false positive. That little bit of blood could come out in the stool and not actually be cancer. It's also probably not a good test for somebody who's high risk for colon cancer or somebody who's had colon cancer before. But for most of the average Americans, starting at the age of 45, you want to think about getting screened. And this is a nice way to check yourself at least once a year, especially in between those colonoscopies.
Okay. Well, Dr. Kohli, this is really important for so many of us to do, not just for us, but for our family members too. So thank you so much for giving us that information.
And make sure you are in good health. 9Health is working to keep you safe with their at-home screenings. Just head to 9health365.org or to a test kit today.